Hi, everybody. Welcome back to the Get Healthy Tampa Bay podcast. I'm your host, Dr. Kerry Reller. And today, before we begin, I just want to know that this show is for informational and educational purposes only and should not be taken as medical advice. Some of the topics that we're going to discuss today in particular include emerging and experimental therapies. My goal is to explore ideas with curiosity while staying transparent about what is well established in the scientific literature and what is still developing. So today I'm excited to welcome Dr. Carter West, a fifth generation chiropractic physician at the historic West Clinic in Pocatello, Idaho. Is that right?
Correct.
It's a family practice that has served its community for over 110 years. Dr. West is certified in acupuncture, Webster technique, and cranial facial release, and blends traditional chiropractic expertise with a wide range of integrative approaches. Welcome to the podcast, Dr. West.
Thank
However, you
you.
want me to respond, like, I don't know. Sometimes we say Carter, sometimes we say Dr. West. But anyway,
Uh,
welcome to the
so
podcast.
uh, I'm okay with Dr. Carter only because my dad is Dr. West, and so we got to find a way to make each other distinct. Dr. West to me is like how Italians will refer to the head of the household as the Don of the family. So I don't have that title yet, so I'm just Dr. Carter.
Just Dr. Carter.
Yeah.
We'll go with that
Yeah.
too. That's
All
perfect.
right.
Yeah, so tell
Yeah.
me this five-generation legacy in natural medicine. What's the story of the West Clinic? How has your family shaped your approach to healing?
Yeah. So we have been in our small railroad town in Pocatello, Idaho for 110 years. My great great grandfather, he started our clinic in 1916. And keep in mind, the profession started in 1895 and our family clinic got started in 1916 and it was very new at the time. My great great grandfather, his wife was super ill at the time and there was a worldwide flu going on around the world at the time and he was a traveling violinist for this local circuit. And he would go all the way from West Yellowstone, Montana, and go to the northern parts of Salt Lake City and just would go around in that cycle. His wife got really sick, so he dropped everything to go to chiropractic school in Chicago. Okay. And then his son, my great grandfather, got really sick with the flu, and my great father performed treatment for him. And Pocatello, the reason why chiropractic was so significant to us is that it is a major railroad hub for Union Pacific Railroad. So coupling train cars was a very violent process back in the day. So you would have a railroad worker on the inside, and then when you couple train cars together, it was very violent, and they had to be inside of it to facilitate that process. And it was really hard on their spine. So they practically had the equivalent of whiplash, right? So whiplash and concussions, those types of injuries have very harmful effects on our brain. So my great great grandfather and my great grandfather had a booming practice working on railroad workers in Pocatello. Um,
That is so interesting.
yeah,
Obviously, the way our country developed really, I guess, created certain professions and jobs, and I've just never really thought about it that way up there. So that's so interesting how that came about. What
uh-huh.
inspired you to follow in that path?
Yeah. I just really enjoyed growing up in a natural health clinic. And I really was craving the purpose and fulfillment that my dad and grandfather had in working. Like they never ever work. It's pure joy to them taking care of their patients. And they call them their family for a reason. Like I love going into the clinic and we have patients there that will be like, your grandfather helped me with this. And oh my gosh, if it weren't for your dad, I would be 6 feet under or something like that, right? And that just inspired me so much. And the reason why people love coming to our clinic is they want to be treated like you're their favorite aunt, their favorite cousin. And there is such a familial vibe that we have. And I really wanted to pursue that kind of purpose. I was a basketball player all throughout high school and growing up and just loved the idea of improving performance and function. And so chiropractic really just it made sense to me. There's a lot of other things that kind of developed in why I wanted to choose this profession, besides the fact that I have a very strong family connection to it.
Yeah, I feel like you had to do it whether you want to do it or not, but you actually are interested in it, which is fantastic.
Yeah,
Um,
and that's the other thing I would caution is that I chose to do this. A lot of people said, don't feel forced. I'm like, no, I don't feel forced. Like I want to help people. Now, I'm like, okay, I'm 6'2" and maybe a buck 90. So going and playing in the NFL or the NBA, like that was my dream was to be a basketball player. And that was probably not likely, but I just realized that I had something unique going on. And it's not just our community. We get people from all over the country seeking our help and care. We've had people from Abu Dhabi, we've had people from Australia come to Pocatello, Idaho for chronic autoimmune. Lyme disease specifically, we really got put on the map with. I
Mhm.
just wanted to keep that going because I recognized that we had something special.
Mhm. Awesome. So you also have certifications in like acupuncture and the Webster technique. What drew you to these different modalities?
Acupuncture is incredible, I think, and it's very versatile. That's why I wanted to do it. It's not just for musculoskeletal conditions. I really liked it for a sprained ankle for basketball because that's the most common injury in basketball, and acupuncture works really well for that. But at our clinic in Idaho, we love using it to help out with digestive issues, headaches, migraines, and those sorts of things. So that's why I wanted to do it. Now,
Mhm.
Webster was really interesting because that's something that my dad doesn't know about. And I was invited to do it by a friend or a group of friends from school. And I just wanted something to do for the weekend. So I was like, I don't really see myself working with pregnancy patients, but why not? I'll just go learn
What
something
is
new.
it? Let's
And I,
describe that first.
so describe it. Yeah.
Yeah.
So what it is, it's a specialized form of chiropractic that specifically caters to the demographic of pregnant women. So
Okay.
chiropractic is really helpful for low back pain, but then how do you address the low back pain you have if you have a growing baby inside of you? So
Mhm.
I really was drawn to, okay, how do I approach this? Because in chiropractic school, we were taught, hey, did you know that chiropractors can help out with pregnancies? Okay, anyway, we're going to go on to this. To that. And I'm like, wait a minute, you can't just pose a problem and not tell us about the solution. And that's where I got really jealous with. So the Klepkos, I wanted to give them a shout out. They were the ones that got me introduced to you. They came from the chiropractic school where it started with pregnancy chiropractic. And so they got a lot more in-depth training and information on that. And I just got exposed to it and my world was open. I'm like, I had no idea that we could even do this. So
Cool.
it's just pretty much pregnancies and how to help have a more natural and conservative pregnancy.
So you're interested in everything, right? From neuroscience,
Yes.
functional medicine, yoga, breath work, ozone therapy, and biohacking. So how do you integrate all of these tools or have you yet in your practice?
Yeah, that's very interesting. So one of the reasons why I wanted to be in the healthcare world is I love anything that is about lifestyle, right? So anything that could make me healthy. And I wanted to find a profession that would harmonize with my values, that I eat good food, I exercise, and I want to be as healthy as possible. And I like the challenge of it because there's going to be patients coming in to see me saying, hey, I have this issue or I need help with this. And I
Mhm.
wanted to be an example for them. And when you have that challenge, like you want to rise up to meet it. And I'm like, it's invigorating. I don't know about you if you feel that way where there's people coming in to seek for your help and you got to be that beaming light, that that example for
Mhm.
them. So that's
Mhm.
why I wanted to do that is I just really like being healthy. I like talking anything that helps out with the human body.
I think, yeah, absolutely. That is like one of the fundamental approaches of some of the things. Obviously, the biohacking, everybody wants to live longer and healthier, and then functional medicine as well. Some other things I think that you were really passionate about was this breath work and nasal
Yes.
breathing. Tell us a little bit why nasal breathing is important.
Okay. So the with nasal breathing, God gave us a nose for a reason. There's mechanisms in there that filter the air, and clean it and bring it into the lungs, you get a better oxygen delivery to your tissues if air is going through the nose as opposed through the mouth. And with mouth breathing, if you breathe through your mouth too much, then there will be a bacterial overgrowth. In this book that I read called Breath by James Nestor, he was talking with a dentist in there that said that one of the most common reasons that I see people with cavities is because they're mouth breathing too much. And when we mouth breathe, that's when we tell our bodies to go into a sympathetic state. So sympathetic for your nervous system, your fight or flight, right? We breathe through our mouth when we're stressed. And then parasympathetic when we're in that safe, that rest and digest phase. So chronic conditions is something that I know that you see, as well
Hmm.
as it's very prevalent in our country. The sympathetic nervous system tells our body, hey, there's a tiger coming after you. We need to stress you out so that way you can run away from the tiger. But why is that sympathetic nervous system still on when you're sitting at your desk? Like you should not be stressed when you're trying to relax, you're trying to do everyday tasks, but that's what's going on with us. And so he meant this book really changed my life. Like he just mentioned that we're doing this habitually. We're doing this while we're even sleeping. That snoring is not just a funny thing. Like it's an actual dysfunction. Like we shouldn't be snoring when we sleep at night. So I emphasize nasal breathing because it is an important part of your physiology. But if you're not moved by how your body works, I would also say that if you're moved by an aesthetic reason, so cosmetic, how you look, people that do a better job at breathing through their nose, they have better facial features, they're thinner, they don't look so puffy around the face. So I mentioned that as well because people might be moved by that. They want to look better. They want to look sexier. So that's one of the big reasons for that as well.
Are some of those like craniofacial abnormalities that we see with obstructive sleep apnea also, I guess, somewhat related to what you're saying with the facial structure being different?
Yeah. Facial structures can be influenced by how we breathe, but recently I learned that even just from the experience of birth and coming out,
Mhm.
it can actually have an influence on our cranial structure. Heck, even and this is something that I mentioned to Dr. Robin Klepko yesterday was like, I was just shocked at how even with the mother's pelvis torqued in a weird position, that can actually have an influence on the baby when the birth happens. So with Webster, what a chiropractor is trying to do is teach the nervous system how to communicate with the tissues effectively. That's why we do adjustments. So that way, like the mother can be in a state to actually relax and have a low stress pregnancy. So I'm only mentioning that because that process can have an influence on the cranial structure of the infant, which can carry
Mhm.
on to the rest of their life as well.
Interesting. Okay. This phenomena, and I don't know, I'm calling it phenomena, but mouth
Yeah.
taping has become very popular as a trend online. So,
Yes.
what has gotten you interested in it? And this is where I might do another medical disclaimer so we don't have the wrong
Yeah.
people trying this tech.
Okay. So that book that I mentioned, Breath by James Nestor, it's a it's a good read, but if I had to summarize the entire book for you, and if there's one thing that the author would have you take away from the book is to tape your mouth at night. And I really like mouth taping is my favorite biohack because I'm blocking my mouth and I'm teaching my body to use my nose when I sleep. Okay. And I want to ensure that I get good oxygen delivery to the tissues. I'm not just overriding it. Like I'm actually trying to tell my nervous system, hey, you need to rest. And like I said before, the facial structure, I really care about that. I care about how I look. So that it was a powerful reason. And I've heard some people say that they feel a lot better when they can get a good night's rest only breathing through their nose. Now, my recommendation for this is if you were to say, hey, I want to get started with it, set a goal for to see how long you can go, right? So maybe the first night you put tape over your mouth and you do 10 minutes, right? And then you have to rip the tape off and then just sleep for the rest of the night. And then the next night, try and shoot for 20. The next night, shoot for 30. And then the night after, 30 to an hour. And just try it. But if it causes you any discomfort, then do what is best for your body. I know that there's some other effective devices out there, like a CPAP, that can help out people with those things. Mouth taping, I would say, I've seen more people do it that are, very fit and young, and they just want to maintain that. For someone that's starting at ground zero, where they have a lot of other issues, and then they just wanted to take a random biohack and apply it, I'm not sure how well that would work for them. I would start them off with some other things like, all right, we're here at ground zero. We got to build you up before we can do all these other things.
Now, are you like physically putting like duct tape over your mouth?
So you can do duct tape, but honestly, I get a little worried about the adhesive that's on my lips, and I hate how my lips feel with that. I've
Paper
tried
tape?
KT, yeah, I've tried KT tape with it, but
Hmm.
recently I just got this, I can't remember the name of the brand, but they have this very clean tape that is specifically used for the mouth, and they use bamboo. It's like really natural and organic. So their pitch was, hey, you can tape your mouth without the harmful adhesives going on your lips and stuff. So
So
I
there's
really love,
actually, I'm sorry, there's actually products that are marketed toward this. That's pretty cool.
yes, there is.
So, just to orient our listeners, the scientific evidence for mouth taping is still quite limited and mixed. A few small
Yes.
studies show improvements in snoring or mild sleep apnea metrics in select patients, but others show that mouth closure can worsen airflow, especially in our asthmatics and other people with nasal obstruction or specific airway patterns. So, definitely something to approach carefully and individually. I would say
Yes.
we do have a very large asthma and allergy population. These people are suffering from nasal obstruction and asthma, and it's not I would not recommend it for that. Like you said, it has to be the right individual. And then obviously, if you are having any sleep issues, getting evaluated for sleep apnea, like the snoring thing you mentioned, is one of the key indicators. And typically, we will do a lot of screening questionnaires in our office on looking for sleep apnea to make sure that we are checking patients appropriately and doing home sleep studies. And you mentioned a CPAP, so a continuous positive air pressure device or a BiPAP can be used to help make you have more airflow. So it's not only in the past, people might used to think that it was just like mouth, like they would open the mouth with the CPAP and BiPAP. But now there's like nasal devices and things like that. And that would be more along the lines of what you're describing, that it can help people. So definitely it's not for everybody. I want everybody to know to be careful on that.
Yeah.
But it's very
Please be
interesting
careful.
with the approach for sure. You mentioned some ways that if people wanted to start out, you mentioned some safe ways already. Is there anything else you can think of that it might be a good or not good idea for anybody?
Honestly, I can't think of anything right now at that moment. But yeah, I loved how you mentioned the disclaimer on that. Really get checked out to see if that's something that's even feasible for you. But this is why I'm expressing it is if you want to improve your performance and you want to improve how you feel, this could be a very good way for you to do that.
Yeah, absolutely. I think if you're in pretty good health and decent, then it's not something that you should be as afraid of. But
Yes.
so another controversial issue that you specialize in is this cranial facial release. That's your technique that you're certified in. From the medical side, we don't really have any great evidence supporting this
Yeah.
procedure yet. I think you can describe it, but to me, it looks like a little bit like a sinus balloon like manipulation of the sinus airways. But I don't
Hmm.
know. From what I looked up, because I was very curious, the research isn't there yet, but I'm always interested in hearing
Yeah.
what clinicians of different fields are exploring. So, can you explain what it is from your training perspective, what cranial facial release is?
Yes. Thank you for mentioning that. That is something I want to say that there are the chiropractor that taught me about it said that there the Australian, I want to say it was like an Australian chiropractic journal or medical journal did talk about this technique. But yes, there definitely needs to be more. So cranial facial release, I just got certified in, and this is personally my favorite technique that I'm so excited to implement as a chiropractor. So what it is, it's practically an adjustment for your face. So the pitch of it is that chiropractors get 80% of their patients better by only adjusting 20% of their nervous system. So 20% meaning that it's anything below the occiput, right? So your neck, your thoracic, your lumbar spine. And chiropractic gets really good results treating those areas for helping the nervous system talk to the rest of the tissues in your body, low back pain, cervicogenic headaches, those types of things. With craniofacial release, it's more of a direct adjustment to the cranium. So they said that the cranium does move, right? So when you breathe in, out, the skull has these little micro movements, right? So it opens up and it folds back, but at a very small level. So I have a skull right here. Sometimes I like props. So
Great.
over here and out here. And you do so by putting a balloon right here into the nose, and it's supposed
Okay,
to
so
go
you're
all the
showing
way.
the nasal sinuses
Yeah,
pain. Yeah, and then there's the
yeah,
septum. Hmm.
yes. So it's really good. One of the reasons to do this is to improve cerebrospinal fluid flow in the brain. So my favorite analogy for this technique is, let's say you had, I hate doing potty talk, but let's say you had a little too much to eat, you try and you flush the toilet, but then it overflows, right? So when the toilet overflows, what do? You take a plunger, right? And then that will create the pressure for the water to actually drain and go out. So this adjustment is like that, where you're creating an intrathecal pressure in the brain to where the cerebrospinal fluid will flow, just like water in the toilet, right? And this treatment has been very helpful for people post-concussion syndrome. I've heard of it treating trigeminal neuralgia, Bell's palsy, headaches, migraines, those types of things. And also, just right here, if you put the balloon in and you go under, the pituitary gland is actually in close proximity with the nasal cavity. And I've heard it do wonders for women specifically with hormone issues, menstrual cycle irregularities. And yeah, like I really like it for that reason as well. So I love anything that can give me a reset on my brain. I'm graduating chiropractic school in less than 10 days. And as a student, I loved anything that I can get my hands on that will give me a cognitive edge, will help me think
Hmm.
clearer, help me breathe. And this technique that I'm sharing, I really felt like it's done that for me. I feel more open when I get it. Like I can feel my brain. I feel like I can think clearer, and I can definitely breathe a lot better when I get it too. With this one, I would like to see more explanation and research in the future on this technique. A lot of the benefits of this are anecdotal. You talk to people and they'll just share with you their experience and how it helped them. I'm
It seems very
super.
similar to balloon sinuplasty that our ear, nose, throat doctors do. What is it? How is it different? And then what would you say are some risk factors of doing that?
Yeah, so with the sinusplasty, if I'm not mistaken, that one is performed under anesthesia, right?
I actually don't.
Yes.
I'm not an
I,
ENT.
I think it is performed with
I don't think so for the
and
balloon, but
yeah. Anyways, I think I wrote a note about that for the sinuplasty. If yeah, with the sinuplasty, if they are going to put you under anesthesia, it's going to take a little bit longer. Whereas
Mhm.
this one, it's very quick. Now, a lot of patients will describe this experience as unforgettable because you are getting a balloon shoved up your nose and then it swells up and you're
Yeah.
like, oh my gosh, there's something inside of my nose, right? But it's very quick. Now, it's not really, it's not so much a painful experience, it's more of an uncomfortable pressure. That's the best way that I can describe it because,
Okay. So I
right?
just
So you,
looked up. Yeah, the balloon sinuplasty doesn't always require anesthesia, but it can be performed with local and or mild sedation or general. It depends
right.
on the patient, the doctor, and if it's in office.
Yeah. Now, with that one, I think with the sinuplasty, they put a tube up and they do a solution that will clear out the sinus. So with this one, it's addressing it more mechanically. And
Hmm.
if you do put the balloon up your nose and then you do the adjustment, it really does help out with draining and helping flow
Yeah.
in the sinus cavities. Yeah, that's one of the reasons why I like it. If I feel stuffy in my sinuses, I like getting this done.
Hmm. Okay. Interesting. Is there
Yeah.
any like risk factors of doing it?
Yeah. So for this one, sometimes you can have bleeding in your nose and towards the back of your throat. That I would say that one's pretty rare. You can get a little bit of a throat irritation. Something that I've seen with this one is for those that have psychological traumas in their life, when they get a balloon, they'll have a lot of times they'll have a very emotional outburst because all that trauma that they're storing in their cranium and in that particular part of their body, it's being stored. So once that gets released, like they'll have a very strong emotional outburst, but it'll calm down a little bit after. But yeah, that one's always crazy because like you never want to hurt a patient or anything, but that can happen.
Got to be safe first, right?
Yes. Yeah. Well,
I know medical doctors, we say do no harm, but I don't know what kind of
yes.
doctors say.
Yeah, we actually, yeah, we abide by that too. I
Thank you.
cannot imagine doing something that would cause more harm than good. I like doing this technique because I feel like the benefits outweigh the risks. But I
Hmm.
always love talking to people through it. Like I have a little poker in case the balloon goes all the way back and they're uncomfortable. I always have a backup plan with this one. Make sure that the patient is safe first and foremost.
Changing gears a little bit, you've practiced mostly, or your family has, in Idaho, but recently trained in Florida. So, what
Yes.
similarities or differences have you noticed between the two health landscapes?
Yeah, so Idaho and Florida have nothing in common. I'm just saying that in general, not from a
Yeah.
healthcare standpoint. Idaho is a very interesting place because, in my opinion, with the chiropractic scope of practice, there is a little bit, it's a broader scope of practice, right? And from what I've noticed, a lot of the East Coast states, they're a little bit more narrow in what a chiropractor can do. For example, some states, if you're certified in acupuncture, like they don't recognize the acupuncture certification for chiropractors. Some states are just very, hey, you are only allowed to do a spinal adjustment. In Idaho, there is a little bit more leeway. So if a chiropractor can get a diplomate or extra training in clinical nutrition, or if they get another doctorate as a naturopathic physician, they can do things such as intramuscular injections and IV therapy, which that's what I'm excited about. I love needles. I think they're very helpful for people. I'm planning on getting extra training. Next month, I'll be starting a second doctorate as a naturopathic physician up in Chicago. My credits transfer over from chiropractic school. And so this will only be 18 months. And having that degree will allow me to serve more favorably to my
Mhm.
patients out west. That's a really good question. That's something I personally geek out about is, hey, what can doctors do or can't do in some areas? The laws in California are different from the laws in Florida, you know? So it's so fascinating, I think.
Yeah, it's different patient population too. And I would assume you're in a little bit more of a rural area, therefore your scope is wider anyway.
Yes, I would definitely say that's definitely the case. So
Yeah.
I don't know if is there anything like that in the medical world for you where MDs can do this in Florida, but they can't do this in Pennsylvania or Timbuktu or whatever?
I don't think so, but I would say from a family medicine standpoint, when you're in a more rural area, you might be doing full scope, right? Peds to
Gotcha.
OB to geriatrics and everything. Whereas when there's plenty of other people to refer to or take care of
Hmm.
pregnant patients or pediatrics, you might not do full family medicine, but that's from family medicine standpoint. There's definitely no like interstate laws that would, prohibit one doctor of one licensing practice specialty to be practicing different than another. We've covered a lot, but what is
Yeah.
maybe I know you might have already mentioned this, but what's one practical tip for listeners if someone wants to take one small daily step toward better health, and what would you recommend?
Ooh, one small step towards practical health. I would just say movement is medicine. Chiropractors are really big on movement,
Mhm.
improving mobility, improving how the nervous system communicates with the tissues of the body. And so if you have a daily habit of moving and exercising, you're doing so much good for your body.
And moving, not
So
just like one big time during the day exercising, right? I often like to tell patients or people to do little exercise snacks, and getting up in between all the times that you're sitting at your desk and things like that is important. And you are not the first person to say movement is medicine on this podcast. I
good.
think we all know, or if you don't already know, we're all learning how important it is to be able to move and to be able to exercise. And that's one of the biggest keys to longevity. I'm sure you would
I agree.
agree.
Movement is medicine.
Yeah. What's next for you? You said you're going off to naturopathic doctorate school, and
Mhm.
then, well, where can people find you if they want to work with you, follow you, or know anything about you or
Okay.
your family?
Yeah, so I got a little bit longer. Yes, I am crazy for wanting to do more school, but my Instagram is at Carter H. West. My family's clinic is West Clinic in Pocatello, Idaho. My dad, my boss, Dr. Jason West. And yeah, so I just want to thank him and my grandpa. They are the biggest examples of what being a healer means to me in my life. And the Klepkos are amazing. I want to thank them for getting me on here and facilitating that connection. They are excellent physicians. I love their practice. And for the time being, I'm at Alessi Functional Health. That's where I'm doing my internship. Dr. Alfred Alessi in Tampa Bay. He's an excellent chiropractor. He's one that's been mentoring me as well. So I just want to thank him as well. So I don't know. I just wanted to do that because like I'm about to start my career, and you don't get good without a little bit of help along the way. And I don't
Mhm.
know about you, but I'm sure that you had some very important mentors and people that helped you get to the place where you are today. So I'm just and plus it's after Thanksgiving, so I'm feeling especially grateful. I'm feeling especially grateful right now.
I love that. And I just will mention we had Dr. Robin Klepko and her husband on a couple episodes back. If you guys didn't catch those episodes, and you can go back and listen. We had a great intro to chiropractic episode, and then a functional medicine episode with Dr. Robbins. Yeah, those are great. And thank you so much for reaching out and bringing your unique expertise on this podcast today. And best of luck in your finishing your studies and in your career. And I've just thank you, Dr. Carter, for joining us.
Thank you so much, Dr. Reller. This has been an incredible privilege. Thank you for bringing me on, and please keep doing good work. What you're doing as a physician, you're doing God's work. And people will need you. And I'm just very, very thankful that you brought me on. So
Yeah, I appreciate that. And I agree. We're all, anybody who's in these kind of, I guess, professions, or I believe in that too. So, everybody, thank you for listening, and tune in next week for next week's episode. Okay. Get healthy, Tampa Bay.
thank you.